Uh, it's a filter. I don't know how to turn it off. But I'm ready to go forward. Um, I'm I'm not a cat. I'm not a cat. We can go forward.
Let's go forward then.
Hi. What's good, everybody? Join by the homie once again, Fa, and of course, Sha, the pod god. You know, we gonna chop it up with y'all. I know the title says as serious as a heart attack, and it's about to get like that. But want to have at least a little bit of fun before we kick it off. How things been with you since the last time we talked?
Hey man, they've been good. Just working hard. Can't complain. Still, socially distancing. You know, following the rules, but living life. How about you?
I can't complain too much. Have the Wizards won any more games?
They're on a 2-game winning streak.
What?
Yeah, they're on a 2-game winning streak. It's crazy.
Did you just get done practicing with them? I see you got the headband on.
Yeah, man. I was just out, just hitting the practice court, just trying to stay in shape, all that stuff. You know what I mean?
They could probably use your help.
Hey, I could shoot, so that's one good thing right there.
Yeah, everybody that can't ball always say, "I can shoot."
I can shoot. I can shoot. I can play D. I can facilitate. I can do a couple of those things.
You got any handle? You don't have no handle.
I'm working on that. I'm working on that.
Gotcha. I also added the homie Heen to the rotation, right? He's a Wizards fan too. He's from the DMV area as well. And homie looked like Kevin Durant, but he couldn't get Kevin Durant to come to the Wizards, even though he's from the area. I don't know.
KD to DC.
Might have to talk to him about that.
Hey man, maybe he'll come down when he's like 37. We'll have a Michael Jordan experience or something like that.
Would you even want that? Like,
honestly, it'd be so Wizards for that to happen, because we always get the Bullets. They always are getting people that are at the end of their career. We got Russell Westbrook right now.
Right.
And he's clearly fallen off. He's not the MVP guy. And God, it's hard to watch. It really is.
There you go. All right. But, the main topic of today's show is going to be about healthcare. And we're going to fully get into it because we hear terms get thrown around all the time. We hear Obamacare, the Affordable Care Act, public option, Medicare for all, universal healthcare, all these things we hear, and people really don't break it down. But that's where we come in. That's why you got to come in poly with us. We going to give it to y'all like every show should be, like going deep into the details of it, because a lot of these terms are just terms. What does that really entail? Well, you're about to find out. But before we get into that, we're not going to spend too much time on the subject. Do you have any comments about impeachment, how that went?
I mean, I think it went as we probably expected it to go. One article of impeachment, which was clear, obviously, the president incited an insurrection. I think the impeachment managers made the compelling case. I think they did a great job, actually. Their presentation was good. But I think, just like before, and we discussed this before we went live, you're getting him on a narrow scope. And I could see their rationale on this one, at least, because I think this one was clear cut. I mean, the Ukraine one last year, everybody was like, okay, what, you got all these phone calls, all these witnesses that were, talking about them, and, people didn't understand that. So all they saw at the end of the process was Trump was acquitted, right? Right now, it's a little different. Obviously, Trump's not in office, right? And Mitch McConnell, we can thank for that, because he didn't want to start this until the 20th or whatever it was, the 19th. But I think this was a clear-cut case. Unfortunately, they only got 7 Republicans. They got 7 of them, and they needed 10 more, right? And I think it was always a pipe dream to get above 60. I think they just did it to make the point that if you're the president and you're in your last month in office, you can't be pulling this shit, right? But at the same time, I think it's kind of dangerous for 2024 because if he or she wins the election, and we have a bunch of Republican senators and congressmen saying that they're not going to certify the election, and they're going to do feed the stop the steal stuff again.
Right.
I think, and by the way, the Congress next time around is probably going to be in the Republican hands. Just going off history, then you got a you'll have a real crisis in, I guess, under 3 years now. Or actually, I'm sorry, under 4 years now, in the early 2025. So I think that's the thing that's scaring a lot of people, but I don't think that you could change that through this impeachment. Unfortunately, the Democrats don't got this majority in the Senate to pass like real democracy reform initiatives that we need. Mm-hmm. And I think that's gonna hurt us. I think as a country, it's gonna hurt us after 2022.
Yeah, and me and we was talking about this last week. His point was he kind of checked out of the whole proceedings once he found out how narrow the impeachment was going to be, because Trump broke the law his entire presidency.
Yeah.
From beginning to
day one.
He it is funny. A lot of these right wingers, they would argue that point, and they make up every excuse in the book. He broke all sorts of monuments laws from the beginning with that. There was a strong case that he broke the monument clause. Not even a strong case. He flat out did it. And granted, I don't think there's nothing Trump could have done where you could have got enough Republican votes to impeach him, but that was a clear violation. And the fact that they had 2 impeachment trials and didn't bring up a monuments not one time, in my opinion, is a failure of the Democrats.
Yeah. I think last year, I think it's unbelievable. Last year they didn't just throw the whole kitchen sink at him with all the stuff that we have, because I think that would have been the prime opportunity, in my opinion, because that could have dragged out for months. Obviously, COVID, would have came and would have changed a lot, but I think they could have. There's so much, and with this one, I can give them a little more credit in terms of it being narrow, or I give them a little more slack, I should say, just because, at least in this instance, we saw it with our own eyes. We saw, it was broadcast in daylight, him saying, "Yo, we're going to the Capitol. We're gonna throw, it's gonna be wild. They're gonna raise hell, all this stuff." He was doing it right there that morning. So, right. That is pretty clear cut. The fact that you can't get 67 senators to convict him obviously says more about his power within the Republican Party. And all the senators that did vote to convict him, they either just got reelected, or they're never going to run again, or I guess Lisa Murkowski in Alaska is the only one who will run next year. And Alaska, they just changed their electoral system where it's ranked choice voting now, so she's probably going to be in a better spot than having to deal with the Republican primary. So it's going to be interesting. Obviously, I think it just lays out, Trump isn't going anywhere. People who say he's going to go to jail, come on. Even if he doesn't go to jail, he can run for president from jail. Really. Even if he gets convicted, they will go after him. New York, there's going to be cases there. I don't know about DOJ. I don't know about, all these Georgia. I don't know if that'll actually become a criminal, proceeding with the whole meddling with the Secretary of State and all that stuff. But there's a lot of stuff. If I was him, I wouldn't I mean, there's a reason why he tried to stay in power. I mean, it's not just because he's power hungry. I mean, he's got a lot of legal problems, and he owes people, $400 million. I mean, that, that, that that's the end of the day. That's what he has to deal with.
Right. And incitement. He been doing that for a while. Like
Yeah.
nobody mentions when he first got elected and he spoke in front of all those police officers, when he was basically encouraging police officers to use excessive force against suspects. Do you remember that?
I remember that. Yeah, was that during the transition, right?
I don't know. Was it during his it was either during his transition. It might have been like his first few months of
Or
presidency.
maybe his first couple months. Yeah.
It was early on, but Trump had done so much that that doesn't even get brought up.
I mean, it's crazy. I mean, there's so much that happened, and it's like, you think about 4 years ago this time, it was like right when like Michael Flynn got fired and like all that drama happened. And it's like, is that really 4 years ago? It feels like it was much longer, So
Right. It is crazy. Like I was hoping we'll be done with Trump, but he's not going nowhere.
He's not going nowhere. And the infuriating thing is, the cable. Like, I mean, I don't watch cable news or whatever, but even if it's not just cable news, it's like even print media, whatever. Like the whole business model is this fool Trump. They're still talking about him. He's been out of office for a month. They're still going to keep talking about him because that's their business model now. It's like, he changed it. I mean, he saved a lot of these media companies just for being as crazy as he was. And obviously, they had a hand in getting him elected because they gave him all the free earned media.
Yep. And the other thing that is getting overlooked here, it wasn't just Trump. It was also the Congress members that helped string along this lie and help with the incitement as well. And I really thought trials should be held for them as well. Because remember, Corey Bush introduced articles in the House for some of the House members that helped incite the incident as well.
Right.
And that kind of getting swept under the rug as well.
Yeah. She introduced that resolution the night of. I remember that.
Because they are just as big as a problem as Trump, because these Congress members helped that lie.
Right.
It wouldn't have got as big without members of the House and Senate carrying water for Trump.
Yeah, and I think the bigger danger that not many people will talk about is the state legislators. In all these different states that Republicans control. Like for Georgia example, they're going to change the law, make it hard to vote. I mean, whatever short of a poll tax, they're going to implement that. So in 2022, they can beat Raphael Warnock. I mean, that's pretty obvious that's what they're going to try to do. And obviously there's going to be legal challenges and all that other stuff, but that's their first priority. And it's not just there, it's all over the country.
Yep.
So you have that going on, and with how well they did in 2020, down ballot, it just, I think, emboldens them even more. Some of these states like Louisiana, Wisconsin, Michigan, Pennsylvania, they have Democrat governor, so there's a veto on that. But obviously Georgia, Texas, Florida, many states, and they have the trifecta.
And you got to think too, because state politics, depending on the state, can be very complicated as well.
Yeah.
Because you remember in North Carolina, when the Democratic governor won, the Republican-controlled state legislators
took his power
away from him.
Yeah, they did the same thing in Wisconsin too.
Same thing as in Wisconsin. So you can take power away, and that's the danger as well. They're going to do everything in their power to stop people from voting, making it harder for people to vote. I mean, that's been the GOP plan for decades on end.
Right.
I mean, the GOP admitted this. the whole time. That nobody bring that up. The
Yeah.
GOP actually admitted to doing this, and people just like, oh, okay, they admitted to it in the early 2000s. Let's just move on. I
Right.
mean, it's on video. It's on video too, and just nobody bring it up. It is crazy. It is absolutely nuts.
Yeah, and unfortunately, the Democrats in Congress, I mean, outside of a few of them, don't see this existential threat to them because, as I've said before, and I'm sure you guys have said before too, you know, the Democrats are going to lose the House in 2022. I mean, unless Trump, Trump could change things dramatically there because he could be such a nuisance in these primaries. But history tells us the Democrats are going to lose the House. And the thing is, they might not even lose that many seats because it's already a narrow majority right now. And they're going to lose seats even before the elections start just off of gerrymandering.
Just off of gerrymandering and redistricting.
Right. Like if I was going to say projection, I'd say they probably end up with 205 seats, right? As like their best case scenario, in my opinion, right? And the Republicans will have 220. So it's like, so that's what I'm thinking, like of what's going to happen. Obviously, it could change if Biden does a great job, if the Democrats actually do, which I don't know if they will, but but obviously that's what history tells us. And then the Senate, it's very narrow majority right now. The Democrats actually do have an opportunity to expand the majority because there's elections in Wisconsin and Pennsylvania, North Carolina, that they could, if they have the right candidates, they could actually win those seats. I think they could actually win them pretty easily if they have the right candidates. And if the GOP has the wrong candidate, and if there's a crazy primary between a QAnon and a, neoliberal conservative Republican, or crazy stuff like that. But even so, after 2022, we're looking at a divided government anyway. So I think it's a given. But if the Democrats were smart, as I said before, they would pass those bills that they passed in 2019. They would get rid of the filibuster. They would get those things through the finish line, and they would effectively end gerrymandering in America. And you would have a more even playing field without all the money in politics as well. You do those two, and you're basically reversing, a couple Supreme Court decisions, right? Through those bills, and then obviously, making partisan gerrymandering illegal. So
I know they're talking about strengthening voter rights in Congress right now.
Right.
Exactly what that entail, how they're going to do that, not sure. But
yeah,
I know that's something that they've been talking about. All right, so moving to healthcare, the topic that we really want to discuss. So the Biden administration have signed 2 executive orders, basically just rescinding what Trump did with the ACA.
Mm-hmm.
That's really all the executive orders is about. They're going back to actually having marketplace marketing and actually letting people know about the exchanges. Trump stopped that during his time.
Mm-hmm.
Millions upon millions of people have lost their health care under Trump. But even before Trump, the ACA was better than what we have, but was nowhere near what we needed. There's a lot of different things that need to be done with healthcare. There is a few provisions that House Democrats are trying to throw in the COVID relief bill. Can you explain what they are?
Yeah. So it's pretty modest in terms of what's going to be in that bill. But the interesting thing is nobody's talking about it because of impeachment and because of, other parts of the stimulus or the COVID relief bill that have been talked about, like the $2,000 checks, unemployment insurance, etc. But they're trying to slip in, improvements to the Affordable Care Act, stuff that they should have did 10 years ago. But they didn't have a chance to because they lost the House in 2010. But under the House bill that I think is about to pass, I don't know if they've passed it yet, but I think they will pass it and get it to the Senate next week. But people with incomes up to 150% of the poverty level would get full premium subsidies if you get your insurance on the exchanges for the Affordable Care Act. And if you're middle income, above 400% of the poverty level, you'd be eligible for subsidies for the first time. So what does that mean? That means a lot of people that are not getting any help on the exchanges are going to get more help on the exchanges. They'll get partly covered on the premium side. And also people who get unemployment benefits would actually get full premium subsidies under the ACA as well. So that's a lot of people getting, either free or partially free coverage. But the problem is, this doesn't do anything about the deductibles. So I don't know what kind of deductibles you'd have to meet on those plans. Everybody knows the Affordable Care Act, insurance plans on the exchanges have high deductibles, a lot of them.
Mm-hmm.
And then you also have, I know the Biden administration, they've reopened the exchanges, I think, for the next couple months. So this could coincide with this reopening of the exchanges that they've done because of, they during this crisis or whatever. So, and then the other problem is that this is not even permanent. It's only 2 years. So once they pass this, it will only last for 2 years. And then in 2 years, what if we have a Republican House? You know what I mean? Yeah. Like the Republicans are not going to be pro-Obamacare in 2 years. So this is basically 70% of Biden's healthcare plan. I mean, this is sort of the meat of what he talked about on the campaign trail. The other stuff that he talked about, the other two things, public option, not going to happen because healthcare industry is all up in the White House, right? And basically telling them what to do. And then the other aspect, which there is talks about it, is federalizing Medicaid fully. So if that happens, that actually will give many millions of people insurance for the first time as well. And that would free up states that have been responsible for expanding Medicaid. Like I'm in Maryland, you're in New York, so both states would actually get a lot of money freed up in their state budgets because the federal government will foot the bill for Medicaid fully. So, and then all those states, Republican states mainly, that didn't expand Medicaid, that would happen automatically. Until you'll see a lot of people actually get insurance in red states, which honestly would be a political winner going into the midterm elections if they do it right. Now, I don't know if it'll make it in this bill. It might make it into another reconciliation bill, but I think there's some talk about that from people that I follow online, reporters on the Hill. But that's basically Biden's healthcare agenda right there. It's not Medicare for all. It's not Medicaid for all. It's not anything like that. It's not fundamentally changing the system. But on the margins, it will help a lot of people. But unfortunately, it won't help. It won't be a permanent solution. It's a Band-Aid on a hugely corrupt system.
Now, question. During the campaign, in his healthcare plan, he stated that no one will pay more than 8.9% of their salary towards healthcare. Have there been any discussions about something like that in this bill?
So for what I've seen from the House Ways and Means, it looks like it's 8.5% up to 400% above the poverty level. So, and that's if you're getting it on the exchanges, it looks like. But in terms of like the wider healthcare ecosystem, I don't think there's anything in the bill about that. So that's another interesting thing. But if they do slip something like that into the Affordable Care Act, that could save some money for a lot of people who are paying insane amount of money for premiums. But I don't know, what else that they're planning to do. I don't know what the Senate is planning to do. I know Bernie Sanders and some of the progressives in the Senate have their own ideas, but I don't know if things like an emergency health care program are going to make it into that bill. I don't know if, I don't think they are. I think we're too far in the game where it's going to be, I think, things on the margin, like community health centers, funding those, because that is part of the Affordable Care Act that Bernie actually got in with Clyburn back 10 years ago when the House and Senate reconciled the bills. I think those things will be fully funded again, but I don't think there will be anything like brand new besides some of these elements of the Biden plan that were talked about in the campaign that I just saw that the House is about to put in. And remember, Richie Neal is the chairman of the House Ways and Means Committee, and he's a tool of private equity hospitals, and and he's notoriously been not letting surprise billing legislation get to the finish line, although they did get something passed in December, but it's not what people were trying to get through. Bipartisan wise too, it's like Republicans and Democrats actually were trying to end surprise medical billing, but he obviously he watered it down for his donors. So
very underwhelming. Very underwhelming. Not even a public option, which you remember Biden promised during his campaign.
Yep.
So another broken promise right there. And the public option, it could work because even with Medicare for All plans, most of those plans do have a bridge with a public option before you go to Medicare for All. So a public option is definitely needed. Now, making Medicaid federal would help a lot. You don't have to worry about governors like in my state, Cuomo, trying to cut Medicaid, which he's been trying to do.
Right.
And speaking of investigations and trials, we was talking about Trump. Oh, it's not just for Republicans. Cuomo, what he did with the COVID
nursing homes,
despicable.
Yep.
Unacceptable. I know the state legislators are trying to strip power from him, which they should do. But I would also like the Attorney General to investigate. Because he had other corruption charges even before this that people don't talk about. That's why when he was everybody darling, I was just like, all right, I get it, because compared to Trump, anybody looks
competent.
Good.
Yeah, if you're just competent and you're just saying what you did, taking it seriously in some ways.
Right. Cuomo was able to speak in full sentences, which I guess is an upgrade to what Trump was doing. And Cuomo didn't tell anybody to inject bleach in themselves. And he was telling people to wear masks. So, yeah, I guess if that's the standard, sure, he was outstanding.
God, the stuff on Twitter, like with those resistance liberal women, these middle-aged white women, suburban wine moms, like thirsting over him. God, it was disgusting. God, it was disgusting.
Really, people really wanted him to be president because he was talking in full sentences. It was crazy, but it have to do because New York is the media center in this country,
and he has a lot of connections. I mean, for God's sake, his little brother's on CNN every night.
Right. So when it comes to that's why he was so popular. But never mind his record in New York. His record as governor is not good. I mean, he worked for the longest in blocking legalization of marijuana. But that's I could get on Cuomo some other time. I'd go
right.
But anyway, the main point was federalizing Medicaid will be big because most of Medicaid is paid for by the federal government anyway.
Exactly. It's like between 80 and 90% on a lot of states, I think.
Right. And some states is paying less than 10%.
Right.
In Medicaid, especially some of these conservative states, they not really putting in a lot of money towards Medicaid to begin with. So why don't we just fully federalize it? It will help the ACA work like it was originally supposed to work anyway. The original ACA plan, like I said, wasn't good enough at all. It was a conservative plan. However, part of the plan was to extend Medicaid. That was part of the plan. But of course, when the conservatives kept challenging, they was trying to throw out the ACA, the Supreme Court, with the vote of Roberts, they was able to keep the law by saying it was a tax, but they said that they couldn't make states take the Medicaid expansion. They wasn't allowed to do that. And that kind of threw off a little bit how the ACA was originally supposed to work. So if you can make Medicaid federal, it would be more in line to the original plan.
Right.
And, through Medicaid expansion, this is a little known provisions that most people haven't heard of. It's getting kind of in the weeds, but let's get in the weeds a little bit. The provision was to allow health centers and health homes. Most people, when I say health homes, not a physical place, it's basically coordination of care. So part of ACA, it gave money to states to create care coordination organizations where they make sure that a patient have, like, if they was on Medicaid and had two chronic conditions, vulnerable population that used the emergency room a lot, it allowed organizations to contact them, help them to keep appointments, help them get providers, specialty doctors, and overall, it was meant to do two things. It was really meant to save the system money from keeping people going to the emergency room by doing preventive care, which is important because it's much easier if somebody's getting checked out and you catch something early till it was a full out. Instead of having a full out problem, they using the emergency room as their primary care. So that was part of the ACA and part of the Medicaid expansion. So that part, it's a lot of little stuff in the ACA because it's a giant bill that people don't even think about. Like we mentioned before, part of the ACA during the pandemic, you can actually give people universal health care during the pandemic.
Exactly.
If you choose to.
Yep. If you really wanted to do it and you wanted to dare the courts to challenge it, you could do it, because the people in, I think the town is Libby, Montana. I mean, they're getting it right now, right. Just because of an environmental disaster that happened there. I mean, you can make the case COVID was, another kind of disaster that happened on the United States. And honestly, you could have, all these people that, got hospitalized, that needed treatment and who don't have insurance. I mean, I think it's crazy that they're not automatically being covered by Medicare or TRICARE or whatever. We have, we legit have 3 single payer, maybe we have 4, maybe. We have Medicare, you have Medicaid, you have the VA system, you have the Children's Health Insurance Program. So we legit have 4 type of programs, government programs, that is the bulk of our spending on healthcare, actually.
Yeah, I know there was actually a plan about TRICARE, kind of using that as a public option as well. I know that could be a little bit sticky because TRICARE is traditionally just used for
veterans, military service.
Yeah, guards and reserves can use TRICARE Select Reserve, I think it's called, as their primary care. So, I guess you could do that. I don't know exactly if that was the best plan, but it's funny.
I think the reason why it was talked about was because it was more, it's much more quicker and much more efficient in terms of covering people. Whereas with Medicare, I think there's more bureaucratic hurdles to go through, and also you might need legislation. I don't know. It was a bunch of other stuff, but it was interesting. It was an interesting idea because I think it just shows we have all these different, we have all
It,
these different programs.
it does. You will have to staff up dramatically with that though too with TRICARE because that would be
Yeah,
taken.
that's true. Yeah,
The people that's in the military and veterans is a very low percentage of our population.
that's true.
So yeah, you will have to hire a lot of people to do that. TRICARE. It's not the worst idea in the world. And thinking outside the box just to do it quickly, yes, it could be done. I mean, I guess you could shift some people over in the federal government or do some mass hiring, but yeah. But the point is, it's definitely a lot of different things we can do, but it's too bad right now. We went from Medicare for all who wants it not being good enough to right now not even pushing for a public option.
Right.
And the thing is, I understand it haven't even been a month yet, right? I mean, it feels like more than that, but it haven't even been a month yet. I don't know. I don't expect all this to be done in less than a month, but it's just about projections and what they're talking about pushing for later on in the year. Also, if they would have got rid of the filibuster, I'd be like, okay, we have some time. But the fact that they kept the filibuster and it looks like you're probably not going to get Manchin or Sinema to reverse that unless you put heavy pressure on them. Because it seems like right now, Manchin has been buckling to some of the pressure.
He has been, yeah.
So,
yeah, he does respond. He does respond to criticism, and then he either shuts up or he's like, no, I didn't mean that, right? Or he says, or like, you know what? We don't. They're like, you know what? If they're going to sink the whole thing, let them sink the whole thing, right?
right.
Like they're not going to sink it because they both don't. They don't have the guts to do that. So
I don't really get Sinema's strategy.
I don't get it. Like Arizona is like uber conservative. Like there's cities in Arizona that have $15 minimum wage. Like
right. Right. And I understand doing the moderate stance, but some of the things that she pushing back against is actually popular, even amongst centrists and moderates, and even some conservatives. So I've heard this, and Republicans going to give you credit for doing this. They still going to call you a liberal anyway. They still going to call you a commie anyway. Right. I mean, hell, on Newsmax, they was calling Mitt Romney a communist. Literally, I'm not making that up. They literally was calling Mitt Romney a communist.
That's crazy.
Because he's supporting the child tax credit per month.
Right.
So, by the way, the podcast was on ABC News talking about that. Just throwing that out there. Podcast stuff. Ain't no big deal. I'm not saying that. I'm just saying. But anyway, yeah, they was even calling Romney a communist. So I really don't get her strategy because the other Senator Kelly, he's not doing that.
No, he's been quiet, and I mean that's kind of like what you should be doing. Because I don't know if Kelly agrees with everything, but I think at the end of the day he's going to vote.
He's a moderate too.
He's a moderate too, but I think he's going to vote for it because one, he just got elected. Two, he's up for re-election again, right, next year because it's a special election. He just won. So he knows he has to deliver. And the two Georgia senators, there's been stories, last couple of weeks about how both of them have been pushing. They're pushing different things in this thing too. I haven't seen the specifics, but like they know they have to deliver. And I believe Reverend Warnock was one of the ones who was talking about federalizing Medicaid.
Right. And Warnock, he's going to be an interesting player because he's up for re-election.
Yeah.
Again in 2022.
And the funny thing is, we're talking about Sinema and Manchin. They're not up for re-election until 3 years from now. 2024. They're up.
And I think maybe Manchin learned it because his GOP governor went against him with the checks.
Right.
So
right.
He kind of boxed himself in. He made the wrong chess move.
He did, yeah.
So with Sinema, I don't know. It's hard to call with her. I think she doesn't really care one way or the other. I don't think she got this big moral philosophy. I think she does whatever she thinks is good politics at the time. people just gotta get through to her that she's in the wrong way, put a little bit of pressure on her. I think she would bend too.
Yeah, and I think she's only been there 2 years, but I think every time I don't think she's ever voted against her own caucus on, like judges. I think she's opposed most of the Trump judges. She didn't vote for any of the Supreme Court picks. Well, there's only been one, so she voted against Amy Coney Barrett. But yeah, I don't think she's been like one of the, I think when the Democrats have been opposed, she's been opposed with them. And I think when they support something, she supported the caucus.
Yeah.
And Manchin's the same way. I mean, besides him voting for Kavanaugh, and I think he voted for Gorsuch too. He voted against the filibuster removal for Supreme Court nominations, but he voted for Gorsuch.
Yeah.
But other than
for a bunch of Trump judges.
But he's voted for a bunch of Trump judges on the federal bench, but he hasn't really. But that's about it. I don't think he didn't vote for the tax cuts, and he didn't vote for the tax cuts was the main legislative achievement that they did.
Voting for Trump judges is bad enough.
It's bad. It's bad. I mean, it's really bad.
That might even be worse than voting.
I mean, for tax cuts. And many of the other Dems have voted for Trump judges. Yeah, none of them get a panel. I mean, the only ones that voted against all of them are like probably Sanders, Warren, probably Booker, maybe Kamala Harris, probably Kamala Harris too. But like other than that, I can't think of, and maybe Gillibrand. But I feel like they've all at some point, both my senators have voted for some of these Trump judges, and I'm like, it's weird because I'm like, okay. Even if that person's not a crazy right-wing ideologue, they're still on the right and they're still crazy.
Right.
And they're like 40 years old. Like, I don't know. I wouldn't want to be on the record with that. But I guess in the Senate, it's weird. It's like, oh, you have to. And this is the old mentality. It's like, oh, the president got elected, so you have to, give him his judges and blah 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 blah. I'm like, get out of here, man. If the Georgia races didn't happen the way they did, you think McConnell's gonna let Biden appointed Supreme Court justice?
No. And so back to the healthcare. So right now we don't have a public option.
No public option.
And federalizing Medicaid is an idea out there, but I haven't seen it.
There's no specifics.
That's not happen either.
Yeah.
I haven't. Also not confident. Biden said during his campaign, lowering the Medicare age to 60, even though that's more conservative than what Hillary offered. Hillary
which was 55.
Yeah, so I haven't heard any discussion about that either. So a lot of the core tenets of what they promised on healthcare, it looks like
that's not going to happen.
Yeah, it looks like most of it is not going to happen. Basically, what it looks like, we're going to get back to just what the Affordable Care Act was before Trump took over. That's
without the individual mandate, which was unpopular anyway. And yeah, I think if the increased subsidies will help a lot of people, but it's not going to really be transformative at all.
So what is the overall solution for our healthcare system? I know people talk about Medicare for all, and sometimes it's a buzzword, and I just want to get a little bit deeper into it. I think Medicare for all or a single payer system would help in some aspects in a lot of different ways. Number one, it can help with the hospitals with negotiations, because a lot of these hospitals is merging together and they form monopolies in certain communities and able to charge ridiculous amount of prices for routine procedures and just routine checkups. Having Medicare for all, which was about negotiation, because the way hospitals make their money is, they make money in several different ways. But one of the ways they make their money is getting it through insurance, either through the government or private insurance. So the reason why government insurance is less money than private insurance with these procedures is because it's a bigger pool and they can negotiate.
Right.
Especially in other countries where I'm not talking about the UK because UK is totally socialized.
Totally, totally, yeah.
But like some of these other countries that have a single payer insurance but still have private hospitals, they could negotiate the rate, or they either have laws stating that a hospital can't charge over a certain amount for certain procedures. And that way that keeps the cost down.
Right.
If we do Medicare for all, and different plans out there, and you can know if you can really negotiate with the hospitals and big pharma to keep the prices down, that will help the system overall and it'd be less money. But that's it's not quite that simple sometimes, because right now the hospital lobby is huge. Big pharma is absolutely a monster. So just pass it. Well, first of all, it'd be hard just to pass Medicare for all, but even if you pass it, dependent on the way you do it, it might still not alleviate all the problems, because right now, just take Medicare, right? There's different options. You have Medicare Advantage, where you have the private insurance that's still in there, or even with Medicaid, where you have private insurances in it. In New York, they call it MCOs, like managed care organizations.
Managed care organizations. Yep, we have the same thing down here.
Yep. So it's government private combination.
Yeah.
And that's tend to be hospitals' favorites right there. You get the guarantee, but you still get the private. So I say all that to say that it's a little bit more complicated just to say, we're going to pass Medicare for all and everything is going to be fine. No, we still need more doctors. We go to Medicare for all system. We definitely going to need more healthcare workers in general. There's still going to be a problem with some of these urban hospitals that's not in poorer neighborhoods, because the wealthier hospitals, not only do they have the insurance in their they have wealthy donors too.
Right.
To them as well, that kind of keep them afloat. You have, you just in the rural communities too, they have some of the similar problems. And you also have the race component where studies, like, I hate when people say studies, but there really have been multiple studies to show if you're Black that you get treated worse, even adjusting for social economics. So those issues need to be addressed too. And I feel like right now we're just focusing on Medicare for all without addressing that. And for me, I think realistically, we should focus on, again, federalizing Medicaid, pushing for the public option, because even with Medicare for all, that would be a bridge anyway. Working on some of those issues I just mentioned, like the race disparity. And I think there need to be a program recruiting more and helping more diversity into the healthcare system. We need more Black doctors, simple and plain. Whether we could start from grade school or whatever we need to do, because it's not going to be solved overnight, but we need people that's not going to have these prejudices. And so we need to work on that. I know I just said a lot, but that's
There's
just
a lot.
Overall feelings on it. You could just give your overall feelings on what we need to do going forward on healthcare.
Yeah, I feel the same way. I think, like you laid it out there, I think the hospital lobbies and the pharma lobbies are the biggest impediment. And I would actually say the hospital lobby is the most powerful. I think they, do not want to see their profits slashed. They don't want to see rate setting on a national scale. Some states do have, rate setting that all the payers have to adhere to, and they use either Medicare or Medicaid rates. Like I know here in Maryland, we do have a system like that where the hospitals have to publish their prices and they have to go according to a rate that's been negotiated between all the insurers and the government plans as well. So they've come to like some compromise, but that has to happen on a national level, and because there's too much wild west out here in terms of surprise billing, people not knowing what they're getting charged for, or they do get charged for and their insurance covers it, and then they still with a bill for like 50K, 100K, whatever it is. Insane stuff. I mean, it's a, somebody said, what's his name actually? John Walker. People should peep his writing. He's in Oregon. He writes a lot about healthcare. He wrote a lot about the Affordable Care Act back 10 years ago, 11 years ago. And he's been writing about some of that stuff a little bit now. He basically says that the American healthcare is a vast criminal organization, basically. It's basically, gangsters running this thing, charging whatever they can and making out like bandits. And I think that in the sense it's so corrupt, like you just said, you could attack it at any particular point. Like, if it's drug pricing, you could get bipartisan support on that, right? Is it getting more doctors? Well, yeah, you could, lower the barriers to going to medical school, right? Like in terms of cost, right? That's the biggest barrier. You have, obviously covering people is one thing. Like we have 10% of the population. It's probably more than that now. It's probably like, 15% maybe now that are not covered or underinsured or whatever. Sure, you can cover them, but what's that coverage going to look like? Is it high deductibles? Could they see their doctor? I mean, those are huge questions, and it's what is it? It's like a sixth of our GDP, like healthcare.
Mm-hmm.
We spend $3.5 trillion. The government's putting up about $2 trillion of that through the various programs that it has, Medicare, Medicaid, the VA, all that stuff, and then the private market that if you're working and your employer is subsidizing makes up the rest, the other 1.5 trillion or so, and that's premiums and all the out of pocket and all that stuff. So it's a huge thing. I mean, the mistake that they made 10 years ago with the Affordable Care Act was that they had the whole industry, they had every different lobby at the table, right? They had pharma in the room, they had the hospitals in the room, they had the doctors in the room, they had all of them in the room. And when you do that, you're not taking on power, you're trying to accommodate power. And unfortunately, their power was very evident in how the legislation was written, especially in the Senate, and obviously how it passed ultimately when the House had a better bill. It wasn't perfect, but it was much better. And
option in it.
It had a public option, and they should have passed it via reconciliation. In terms of where we have to go, I think the U.S. is so big, and so obviously we have the resources. It's just how we allocate it and how it's administered. I mean, I think that's the biggest thing. Like we do have the human capital to get people working in the healthcare industry, on like single payer or whatever government program that you would have to administer. But at the same time, I think the way we're structured, I think countries like Australia, where they have a Medicare and they have private insurance, or Japan, Germany, Taiwan, those are systems that I think would also be relevant to us. I think because they do have they have multi-payers, right? Obviously, they have a core government program,
right,
but they have multiple payers. I think we should, and I think just administratively, that's the route we have to go, because I don't think we're going to be able to do UK style healthcare system. I mean, we sort of do have it. We have the VA system, which is the exact same thing, but I don't think we're going to be able to do that on a national scale. Obviously, the Canadian system is, a lot of single payer activists here in the U.S. point to, but that started, with the provinces, right? That didn't start nationally.
Mhm.
Started Saskatchewan first, and then it moved to the rest of Canada. Like in the US, the crazy thing in here is like states, if you wanted to do a single payer program, you can't even do it. Like you need a waiver from the federal government through the Affordable Care Act to do that. You have to get a single payer waiver. So actually Biden, the HHS picks Javier Becerra, who's the Attorney General of California right now. In the House, he was a co-sponsor and was a pusher for Medicare for All, but he has said he would grant waivers. The Trump administration, I don't think they were not going to grant waivers, but he said he would. So that would be interesting because then you could have, like, I know Vermont tried to do it, but the problem with Vermont trying to do it was you couldn't get a waiver to use the federal government money you were getting from Medicaid to put into a public option program. So and they try to finance the whole thing through taxes. You can't do it. It's not politically popular. So that's part of the hiccup there. So yeah, there's a
Yeah.
lot of different ways to go about it, but
There's a bill in New York State right now. I mean, actually been for a few years. A single payer system in New York State. I know because the Democrats have more of a majority right now. There's a little bit more hope with that.
yeah, they got super
I just
majorities.
don't see it happening in a state like New York with so much big industry. Although, you know, it did pass in California, I think, through was it the Senate or was it the House in California?
I think their state senate passed it, but the House didn't pass
Did
it.
not pass it,
Yeah,
right? It it is interesting. You would think big business would be on board for a strong public option or a single payer system,
right.
considering the fact that healthcare is a big expense when it comes to business.
Exactly. And
Well, even maybe not even big business, but like at least small businesses should
right,
call for some type of public system.
right. And if you do it like Japan or Germany do, I forgot how Australia does it, but Japan and Germany, they levy a tax. I forgot, it's like 7%, 8% employer tax to fund their systems. Like, honestly, if you're a business and you're paying up to your nose in premiums, like the tax would save you money.
Right.
Like, because you're basically paying a private tax to the insurance companies right now. And, I feel bad for, businesses that, I don't even know how small businesses do it right now. I really don't, like how they can have insurance options for themselves and the owners and the employees. Like, I know like 20 years ago, like when my dad had a small business, it was tough back then,
Yeah.
to even do that. And healthcare was not as expensive as it is now.
Right.
So I don't even know how people are doing it. I mean, and it's going to come to a head. I mean, it's not sustainable. We see it every day. All the GoFundMe's, all the medical bankruptcies, all the hospitals that are closing.
Hmm.
I mean, it's not sustainable. Unfortunately, Biden didn't run on transformative, healthcare ideas, and the Democrats are content with the status quo.
Right.
Um, and unfortunately, too many Democrats in state legislatures are also on the same wavelength there.
Right.
And unfortunately, and then obviously the Republican Party, unfortunately, they have zero ideas because the Affordable Care Act, because the Affordable Care Act
That
was
was their
their
idea.
policy. So
That was their idea.
they have no ideas.
Yeah.
Um, if they did have
Obama.
if they did have ideas, it would be interesting. But it's all about health
Yeah.
savings accounts and deregulate, and all this other bullshit.
Yeah. Obama co-opted the Republican healthcare plan, basically.
That's basically. I mean, even though they'll say Romney Care, so Romney did in Massachusetts,
Mhm.
but you go to 1972, that was the Richard Nixon's plan.
Richard
How
Nixon plan. That was also the Heritage Foundation plan
Heritage Foundation in the
to
80s and 90s.
counteract what they
Yep,
called Hillary Clinton care. In
Hillary Clinton Care in the 90s. Yeah, exactly.
yeah.
That's basically their plan. Like the
Yeah.
Republicans, that was their plan for 35 years before Obama even came along.
Right.
Um,
Obama he just read the room wrong.
he read it
He
wrong.
thought that, oh, I'm going to be Machiavellian. what I'm going to do, I'll make the deal with Big Pharma. Well, to be fair, Big Pharma actually came through and did pay the 80 billion with advertisement, and that's why they agreed not to touch Big Pharma at all with the ACA.
Right. Right.
But he thought that, okay, we're going to do this individual mandate that would give insurance companies a lot of business, which it did.
It did,
But
but
insurance companies just don't want to be told what to do at all, so they still fought it.
right.
So that didn't work. The Republicans wasn't on board with it, even though it was a Republican plan, just because Obama was in it. So, you know, and before, Republicans used to bring up the Singapore model as well.
But Singapore, yeah, because it's like very capitalist economy, very deregulated. But
But
that
they still have universal health care.
they still have universal health care. Exactly.
Yes, they have private insurance, but
Yeah.
they do give out subsidies.
Exactly.
Yeah,
Exactly.
like, so could a model like that work? Maybe. I don't think it's the best model.
I don't think it's the best one, but I think it could work because what other not Austria, but actually I think Austria uses that system. Switzerland uses that system.
Switzerland does too.
Yeah, they use that system.
ACA passed, they was comparing it to the Switzerland system, but it's
Yeah,
not the same.
it's not the same. I mean, if the ACA was, fully funded and you had the public option and you had, all these other things that were not in the bill, yeah, it would be comparable, I think.
Right, right.
Yeah.
So I'm just going. Do you have any closing comments?
No, I mean, I think, healthcare is a huge topic. It's like I said, it's such a corrupt, immoral system where it's like you can attack it so many different ways. Since it's so huge, like we talked about surprise billing, for example, like that was something that easily passed, within the House and Senate in terms of their spending bills or whatever. But stuff like that, I think if you could you definitely can get a left-right coalition onto some of that stuff. But in terms of like really transforming it, like we really need like mass movement, people like legit people on the streets about it, and because like the way the single payer movement's been moving for the last 25 years, I don't think it's working. And I know there's a lot of stuff online about force the vote, and
Yeah,
all that stuff. And I think that's just a reflection. I think that's just a reflection of the single payer movement kind of being in the wind right now. Because like obviously there's a lot of institutional players like the unions, like the nurses unions, right? Or some obviously we have some politicians, we have some NGOs, we have some of that stuff, but it's not powerful enough to. It's gotten more powerful in the last 5 years. Like we're in a lot better place than we were in 2014, 2015, but it's not powerful enough. And the problem is, even the progressive Democrats don't really have a big theory of how you get there. Like,
well,
I
and this
think that's in my opinion.
the thing is they don't explain it right either.
Yeah,
In
yeah.
my opinion. I think we might have been talking about this off air, and this is one of the reasons why I wanted to start a show like this. Um, you know, most people I know I reach out to are people that look like me. Um, so progressives a lot of times don't do a good job of explaining why these policies would help Black people overall. Like take healthcare for instance. A lot of Black people have a mistrust of the healthcare system for good reason. Um, Number one, people always bring up Tuskegee, which of course,
Yep.
of course, experimentation with syphilis. But beyond that, just earlier I was mentioning conspiracies amongst um, results in healthcare, even when you adjust for social economic status. Um, a lot of Black women giving birth. There's a lot of Black women is much higher to die during birth or something being wrong with the baby or
Mm-hmm.
something happening during birth. Um, a lot, and it's not genetics. A lot of it is environmental factors.
Mm-hmm.
So you have to explain why a policy, and a lot of Black people right now, would push for reparations and being sick of not having policies directed specifically for us, are less willing to hear you out. So you need to explain specifically how you're going to address certain stuff. When you just say my policy is going to help everybody, that's not a selling point.
Mm-hmm.
Okay, like, the way to sell Medicare for all is like this. Okay, part of the bill, it will be more money, or even with a separate bill, it will be more money to reach out to hire more Black healthcare workers or train more Black doctors, um,
Mm-hmm.
and or consequences when it comes to unfair practices.
Right.
There's a pattern. You got to do something like that. Make it specific into how it's going to help you. And you just can't say minority.
Right.
When you talk to other groups, you explain to them how exactly it's going to help them as well.
Mm-hmm.
When you go to the rural areas, like, it's a disconnect there too with poor rural voters. Something like
Right.
Medicare for all, how's that going to help the hospital systems in the rural areas?
Right.
Are they going to make more money? Is it going to be able to keep these hospitals open? Like, you have to explain to people what's in them, what's in it for them. And a lot of times, I think too many progressives live in their own bubble, and it's like an echo chamber. They just talking back and forth with each other. They just use these buzzwords: Medicare for all, single payer.
Facts.
What exactly does that mean?
Right.
And how it's going to help you?
As
'Cause,
if it's like a magic wand, you know.
right, you gotta explain how. And then for somebody that actually have good insurance, that have a good job, have a good have what they consider good insurance, you gotta explain why should they get rid of their private insurance to go to a Medicare for all system. My point is this: what if you on vacation
Mm-hmm.
and God forbid something bad happens, an accident?
Right.
You go to the emergency room. Will your insurance pay for it, or will they not pay for it because you're out of network?
Mm-hmm.
Like, you got to explain it like that too.
Yeah.
Or the company, because there's contracts too with healthcare. What if your company suddenly decides to go with another healthcare option,
Mm-hmm.
and you know there you don't have a plan to choose from, or the next plan your employer give you is not as good as your previous plan, or you suddenly get laid off?
Exactly.
Cobra Cobra is very expensive. Cobra is
Yep.
not affordable.
And
So
yeah.
yeah, so we have to do a better job. And like I said, the reason why I have the show, I want to explain to both sides, to progressives and to Black people. Because some of my Black friends, I sound like a white person. Some of almost all my friends are Black, which is crazy. But but a lot of Black people I talk to about politics is like all reparations, and I agree. I'm 100% for reparations, but I'm like, reparations is not a cure all either,
Yeah.
because when it comes to something like healthcare, like I just stated, it doesn't, like, even when you adjust for social economics, we still get worse healthcare outcomes. So it's more than just reparations, and reparations is not going to make everybody rich. Even if
Yeah.
we get reparations, if we deserve it. It would get a lot of people out of tough situations.
Mm-hmm.
But best case scenario with reparations, if we get something like what the Japanese got for the internment camps, the 25,000 that they got, right? 25,000, definitely not rich.
No.
It would get you out of a bad situation,
Right.
but it's not like we all gonna be wealthy. So you still have to concentrate on other policies too, because reparations is not a cure-all either.
Exactly. Yeah.
So Like I feel like this is a show that kind of bridges the gap and talk about both aspects, and that's what I want to do. Start thinking outside the box because I know some people's getting it's like a one track mind. Whenever anything come out, it's like, okay, we're reparations. I'm like, yeah, I understand. I support it too. Like I've been on reparations for literally decades, even though I'm young. Like I'm not even joking.
Right.
Like when I first started getting into it, I was like, yeah, we need reparations. So I'm not new to reparation discussion, but I'm like, yes, it's not a cure all. There are other things that we need to do. And reparations is going to be it's not happening tomorrow. So what you going to do? You're not going to do anything until we get reparations. Same thing. The progressives. Okay, I know you want Medicare for all.
But is there anything else that matters to you that needs to be fixed?
Right. So
You know what I mean?
not going to take federalizing Medicaid because it's not Medicare for all. That doesn't make sense.
Doesn't make sense. It's stupid. It's dumb.
Yeah, I know I went on a tangent there, but that's like,
hey,
complicated issues and like people simplify them too much. I'm like, okay, in the meantime, what can we do to make people's lives better until we get to the ultimate goal? It's not 0 for 100. When we got when Medicare passed, I mean, that didn't happen overnight. Truman was trying to pass healthcare. Before Truman, even
Roosevelt
with the progressive agenda.
Yeah.
Ran. Yeah. So that's early 1900s. This stuff.
That's in the 40s, man. Like, and then you didn't even get Medicare until 20 years later with LBJ. You know.
Right.
And the crazy thing is, you didn't have a 60-vote filibuster back then either. I mean, well, for that. So the reason why it passed so overwhelmingly was like all these Republicans were like, all right, let me just ride the wave because it was going to pass anyway.
Yeah. So yes, we do what we can. You don't settle, and if you have the power to do what you want, do what we need. Let's do it. We don't want to waste opportunities like we did in 2009 and 2010 with the ACA. You don't want to waste opportunities, but be strategic.
Be strategic, and that's why I'm saying like the moment should be so urgent for the Dems because 09 and 10 they had 59 seats in the Senate, then they had 60 for like 70 days. And obviously Ted Kennedy died and all that stuff. Scott Brown came in and all that stuff. So right now it's 50-50. I understand it's slim, but look, you got all these old ass senators. You know what I mean? And some of them are in states where there's a Republican governor. Like you got to get your shit together. Like hopefully they pass this bill in the next couple of weeks. It's probably going to be in early March, but then they gotta. I mean, they got to get rid of the filibuster, man. That's like, if you want anything of consequence in the future, you get rid of it. Otherwise, the Republicans will come back in 2 years and they'll control it again, and we're back to where we were in 2013, 14.
Yeah. And it just goes like.
It just goes.
The Republicans made that mistake too when Obama was actually, for some mind-blowing reason,
trying to cut Social Security and Medicare.
They had what they wanted, but because they needed 100%.
And he sent Joe Biden to the Hill to get these senators, and then all these senators were like, "What the hell are you guys trying to do?" And I remember that clearly. They rebelled. Like I remember Harry Reid was like, "What the hell are you trying to do?" Bernie Sanders was like doing rallies outside the White House. I remember that so clearly.
Yeah.
And people forgot.
Like the whole commission.
Yeah, and this is why I'm not happy with Biden or whatever, but like he's better than Obama. I mean, it's already pretty clear he's better than Obama. Like he actually, I think it's pretty clear. It's not saying a lot. It's not saying a lot, but Obama was way more ideological. He's very steeped into the whole neoliberal mindset, the whole technical, like you said earlier, they were trying to feel themselves like get smart, like with the whole, we're going to go with the Republican plan because it'll get us bipartisanship, and not a single one of those motherfuckers were going to vote for it when they could have just easily went on what they ran on their platform in '08 and just put that shit in the House and could have on the Senate side. But with Biden, I mean, yeah, he's not going to get the public option. He's not going to get those things he promised. But at the same time, the way he's moved and the way they're actually, like his chief of staff, Ron Klain, he actually listens to progressives. Doesn't mean they're going to do anything, but at least they have him come into the White House. Like Obama, he famously told some of those senators or whatever, you guys only look at it, half full or whatever. You guys never, or half empty. You guys never see anything half full. I'm like, what's this poverty-stricken analogy you're trying to put on people? Like, if people read the book Crisis Wasted, like about Obama, the administration, like you would just like, if you're an Obama fanboy, you'll like completely be like, get the hell out of here. Like I'm not gonna, I don't know how many people feel that way, but like for me, that was the first person I voted for president, right? When I was 18 years old, right? So obviously, like many people on the left side of the spectrum, after 2011 when Occupy happened, and when you start really seeing what's going on, and then you start reading more about that stuff, and all the people that he appointed, how terrible they were, the Wall Street goons and all that stuff, like the Tim Geithners and the Larry Summers and the Rahm Emanuels. Like, okay, Biden's team isn't great, but he doesn't have many of those ghouls there.
I mean, not by choice. Just the reason why
not by choice, because there's actually pushback. There was no pushback in 09 and 10.
Right. But that's why I can't say that Biden is better, because he still have the same mentality and a lot of strategies during the Obama administration. Biden was one of the main forces, like the Simpson Bowl Commission.
Yeah, he was all for that shit. Yeah,
making the Bush tax cuts permanent. That was Biden.
That was Biden, and Bernie was filibustering for 10 hours. Yeah, I remember that.
So like, yeah. I can't give him credit because maybe if he wasn't vice president at the time and pushing for those very same policies, not to mention when he was a senator.
Oh yeah, I mean this terrible record. Yeah,
terrible record in the Senate, and even when he was president-elect, he tried to put Rahm Emanuel in his cabinet.
I know, and now Rahm Emanuel is going to get an ambassadorship because, of the pushback. Yeah, I guess I agree with what you're saying.
Right.
I agree with what you're saying.
I think to put Emanuel in his administration.
Yeah.
There was even reports that he was talking to Summers again.
Back in the summer, I remember that. Yeah.
Yes. I mean, he got people like yelling, but she got massive conflict.
She got conflict of interest, but she's not. The thing is, she's not a creature of Wall Street per se, right? She's not somebody who was running, things like Geithner was, and obviously, yeah. I don't know if she would. Right. I don't know if it would be different.
And for foreign, that's domestic, and for foreign policy, I mean Blinken. Oh my God!
Oh God, Blinken. Yeah, I mean, yeah, he's been for every freaking war that's happened in the last 20 years.
Yeah, Blinken. I know Blinken was in the Obama administration too, but he was deputy
Secretary of State.
Kerry.
Yeah.
So, or was he under Clinton?
No, he was under. He was under Kerry when he was at the State Department. Yeah. He was the Deputy National Security Advisor when Hillary was the Secretary.
Okay. But yeah, he had massive conflict of interest.
Oh yeah, he has massive conflicts of interest. I mean,
even though I'm happy we finally got a Black defense secretary, he had massive conflict of interest.
He was on the board. He's on the board of Raytheon. There's a whole bunch of it. So what I'll say is, the reason why I said better than Obama was less bad than Obama, right?
It remains to be seen.
It remains to be seen, but I think, I think the progressive wing. So we actually do have institutions now that actually can do pushback and highlight some of this stuff, like in DC and around the country and stuff, that we didn't have in 09. The other interesting thing with Biden, just in terms of pure Democratic Party politics, he's a much more party-oriented politician than Obama was. Obama had his own thing with OFA. You know, he didn't really care about the state parties. He didn't care about the DNC. He just put his own people that supported him there to raise a lot of money. Biden seems to be moving a little differently. I'm not a fan of Jamie Harrison, but Jamie Harrison was a party chair. And there's, you know, they did, he didn't have his own separate organization during the campaign. That's better for the Democrats going into next year than it was in 2010. 2010, the Democrats were starved out. Just their whole party infrastructure starved out. Won't be the same case this time around, but if you're like in Democratic Party politics, is a better time than it was 10 years ago or 11 years ago.
And don't get me wrong. I'm definitely not an Obama apologist at all.
Yeah.
Like,
but as time goes by, it's just you just see, like, I don't know, you just see like how the opportunities were wasted. Yeah. And how if he moved just a little bit differently, I mean, you know, there's no Donald Trump to worry about.
Like I was saying, I did read his book. It's a lot of revisionist history.
Yeah, it's honestly, his book it's well written, but it's hilarious to read.
But yeah, but at the same time, so I'm not an Obama apologist, but I despise Biden. I really do. Like, it's not many politicians I dislike more than Biden. To be honest, like, I threw up in my mouth a little bit when I voted for him.
Well, you had to vote, yeah. I don't blame you. I don't blame you.
Like, the amount of damage he have done through his Senate career and some disastrous policies he pushed as vice president, it's amazing how you can fail up.
It is amazing. It really is. I mean,
like, he wasn't a good senator. I mean, I guess he was good in the sense of party, but actual policy, wasn't a good senator. Somehow fell. Oh, not even. We forget he plagiarized. Anybody else?
His first campaign, right? Yeah.
Straight
Labor Party leader speech.
He was a Dixiecrat,
right?
Even though Delaware is not a Southern state. He gave the eulogy to Strom freaking Thurmond funeral.
Yeah.
Strom Thurmond is a walking human piece of shit.
Yeah.
For real. I'm friends with Trent Lott.
Trent Lott. God. Yeah. The crazy thing is he's been in DC so long. I saw a stat. It's like he served with like 18% of all people that have served in the United States Senate. Something like that. Something crazy. I don't know, like 20%. I don't know, something like that. That's just crazy.
He had one of the worst presidential campaigns ever in '88. Ever.
Yeah, embarrassment.
Yeah, he got like -3 votes in the 08 primary.
Right, no wait. Had to drop out the night of Iowa.
But somehow
got to be vice president.
Completely incorrect, and that's what they felt Obama needed at the time. He felt up the vice president. His campaign, I mean, this last presidential campaign in 2020 was terrible. Like, good God, he ran a terrible campaign.
He got saved by the guy who was in the White House.
He got
and COVID.
Well, even before COVID, like just in the primaries.
The earned media, yeah, that he got, yeah.
But people were scared of Bernie Sanders, and Bernie Sanders ran such a bad campaign.
Bad campaign. His campaign staff was amateur hour.
Like, he ran a bad campaign. So did Biden. But because the media likes Biden, and Obama called in a few favors, Bernie missed opportunities. Elizabeth Warren could have really took it, but she missed a bunch of opportunities too. She ran a good campaign in the beginning, but then towards the middle, I don't know what her campaign was doing. I don't know what they was doing.
Yeah.
But he felled up the president, and then he just happened to be running against a moron in Trump. And Trump would have just took COVID seriously, he probably would have won too.
He probably would have won.
You know, I'm fair. I give credit where credit is due. So far in his presidency, he have done some good. Well, we think is good, depending on what end up in this COVID bill. If they end up getting baby bonds in there, if they end up legalizing marijuana, if they end up getting this child tax credit in there, it'll be a good job. I will give them credit. A lot of these executive orders is really about.
It's just reversing, yeah.
But yeah. So I'm not a big Biden fan. Like so far, some of the stuff that being brought up, I want to see the end result. But it sounds decent.
Yeah.
But we'll see. If it turns out good, I'll give them all the credit in the world. I don't care who you are. I give you credit. I'm not going to erase what I think about you and your past policies, but yes, I can give you credit with that, and I'll end it on that.
I think that's a great way to end it at.
Is the Wizards playing?
Nah, they're not playing, but the Suns are going to play the Nets later tonight. That's going to be a game I'm going to peep. So that'll be a good one.
Harden's killing it with the assists. They have no defense, but hey, they fun to watch.
Exactly, I know, right? Kyrie's like, hey, I'm the 2 guard, you're the point guard. So far, it's working. I don't think KD's with them on this trip, so
they fun to watch, but goodness, they don't play no defense.
They don't play defense. But, my Wizards beat them twice, so
it's going to be interesting. I wonder how injured AD is with the Lakers, so that's a lot. If he Achilles, that always concerns me.
Well, I saw Rachel Nichols was talking about it on ESPN the other day. They said it's a not tendonitis, it's tendinosis or something like that, and that's worse because that's like your Achilles is at that stage where it's just degenerating to where it can get torn, and so apparently the only way you can do that is to rest it, right, for like 3 to 6 months or whatever. So if they just rest him the next 3 months,
I'll rest him to the playoffs.
Yeah, I mean the playoffs don't start till May,
so
you could theoretically rest him until the first round. They might be good enough to beat whoever is the 8th seed or whatever.
That's what I would do.
But that's kind of dicey because the West is, I mean, we don't know who's going to be at the bottom of the West, but depending on the matchup. But I think they could win a first round series without him.
Yeah.
So,
if of repeating without AD, so
there's no way they repeat. And if he's hobbled,
Durant when they rushed him back.
That's what I was thinking about that too because they diagnosed him with a calf injury yesterday, right?
Mm-hmm.
And that's the same thing that happened with KD 2 years ago when they were playing the Rockets in the playoffs, and then he came back in the finals, and obviously we saw what happened. So. If I was them, I just would not play him for 3 months.
But here's the thing: they can't keep playing LeBron like 40 minutes either.
LeBron, he can't play. Yeah, he's older. He can't be playing this many minutes. But
he doesn't look like it though. He still look like
he's 36. But I mean, there's not that many people at that age in NBA history who are going to play 35, 40 minutes. But he is one of them. I mean, Karl Malone did it. You had. I'm trying to think of other people at that age. Kareem was playing like 30, but he was not carrying the load. You got MJ when he was with the Wizards. Yeah, he was playing. I mean, he wasn't the same player, but he was still really good. He was playing, 35 minutes a night, 32 minutes a night here in DC.
When Malone went to the Lakers, how old was he? Was he like 38?
He was He was about to be 40. He was about to be. I think he had already turned 40. Yeah, he was 40. Yeah, his last year with the Jazz, he turned 40, I believe. And he was still averaging 22, 23 points a game.
Yeah, when he went to the Lakers, he just fell off. I think he was injured most of that year. And then
so the thing is, I remember that season. That was the season Kobe kept going to Colorado because of the rape case or whatever.
Yeah.
And he was flying in after court to the arena. Yep. I mean, that was crazy. I don't even know how he was able to play. That's wild shit right there. Yeah. But the games where he didn't play, Malone and Shaq and Gary Payton, they were able to still carry the load.
I thought Malone was injured a lot that season.
So the first 20 games of the season, Malone was playing like he always played. Like he was not averaging 20 points because you can't average 20 points at Shaq and Kobe, but he was still putting up 15 points, 8 rebounds, whatever it was. But then he got hurt. Then his knee went out. Then he didn't come back until the playoffs.
Yep.
And then when he was in the playoffs, he looked washed because he was not fully healthy.
Yeah.
But the crazy thing with him was, I think up until that point, he only missed like 8 games in his career, since from 1985 to 2003.
And Gary Payton, that's when you could see the fall off.
Yeah, you could see the fall off. That's when it started. He was still a good player, but he was not an all-star anymore.
Nah.
That's when he transitioned to becoming a knockdown 3-point shooter.
Right.
And then when he went to Miami and he won the title there, he was making threes.
Got struck by the Pistons, but they didn't. But
right.
we get all off targets. So we're gonna get off here. Hopefully y'all got something out of this discussion. We'll chop it up for y'all. Put this in sections. I know this is a little dense. Thanks for joining us. Don't forget to subscribe, share the videos. Peace.